Without health care, there is no happiness, and attention to health then should take the place of every other object. U.S. President Thomas Jefferson. Did you not know what this quote was referring to? It wasn't referring to socialized medicine or the government paying for it. It was referring to that there should be education in health, there should be science research. That's what this quote is in reference to. And that human reason. Look, I think that you guys that want to push the socialized medicine, I don't think that you're the same people that think it's okay to kill somebody. So I don't think you really want things to be better in healthcare. You don't want to consider another option. You just want Medicare for all across the board. So I'm saying that because here's the dangers of your plan. Increased taxes. Socialized medicine often requires significant increases in taxes to fund the system, which can be a burden on individuals and small businesses. Potential for abuse and fraud. Large government-run healthcare systems can be vulnerable to abuse and fraud, potentially leading to waste and misallocation of funds. Lack of innovation. Socialized medicine systems may stifle medical innovation, as private companies and individuals may be less likely to invest in research and development due to government control. Government control over healthcare decisions. Socialized medicine systems give the government significant control over healthcare decisions, potentially leading to decisions being made based on budgetary constraints rather than medical necessity. So that one's really important, because this is why socialized medicine only works in very, very small countries. Because the moment it becomes too much and too overwhelming, and that quickly happens in a big country, then the government will start cutting, and that's when they tell doctors that you can only see this amount of patients. This is all we'll pay for. So the government will then deny whoever and anybody they want. That is what happens in, like, the UK. That is what happens in big countries that have socialized medicine. But your side seems to think that their problem is that if we had socialized medicine, that will fix everything. No, you will just have the government not caring at all that they deny your loved ones. Now, it may seem like it's no different, but in the meantime, everyone's health care will even be worse, because that means no one will be able to get in to see anybody. That's the reason America has stayed away from socialized medicine. Here's another big one that always happens, and it's a scary one. Discrimination against older patients. Yes, because they often have more problems than others. In some socialized medicine systems, older patients may face discrimination in terms of access to care, with some patients waiting longer for treatment or being denied procedures. Insufficient allocation. Socialized medicine systems may lead to inefficient allocation of resources, with funds being spent on bureaucracy rather than patient care. And another big problem always happens. It's already, it's rationing care. Socialized medicine systems may prioritize certain treatments or procedures over others, leading to rationed care and potentially life-threatening delays. Limited access to specialized care. In a single-payer system, patients may have limited access to specialized care, such as cancer treatments, due to a shortage of specialists or limited availability for treatment. So you can say all the quotes that you want. The fact is, you don't want to address what I'm really trying to say, and that's that healthcare is worse under socialized medicine. But I don't think that you socialists, you don't care that it's worse. I mean, you're also the people that are fine with murdering to get to your goals of socialized medicine. So you know the truth of what it is. It's not that you care about people all having access to health care. I think it's literally you support it because you want to destroy America, because the government is not going to have any problem denying procedures. This is why it's hard when somebody gets really sick under socialized medicine and they need a specialist. It may be a year before they can see a specialist. Many times they'll come to the States if there's somebody that has enough money, so they can get treated. But because it's a rationing healthcare, because the government should never be funding healthcare, because they will cut people off. That's what you will have. I'm not saying that our system now operates well. It doesn't. It doesn't, and we have nothing but greedy bastards at the top running it. I have a feeling that the socialists might, you'll probably have some sway with this administration coming in. There's enough, liberals that are being appointed. There's enough globalists, so, you'll probably get what you want, would be my guess. But it's not going to make anything better. It will be worse. I understand that it's bad now, and add to that AI, it'll be even worse. But government-run healthcare means the government's paying for it. And given that they've already been allocating our money to places it shouldn't be going, then just imagine what that would be like here in America with healthcare. It will be a rationed system, and we're already under a rationed system when it comes to supplies. Yeah, we didn't used to be rationed on supplies. Now we are, because the government is in healthcare too much, which is why the government is even controlling the private sector. So bringing in the government fully into healthcare, well, it'll be much, much worse. But I'm not going to respond anymore. You don't want to listen or hear the truth, because you're not about what will make things better. You're about what will make things worse. Anybody that is supporting the murdering of someone just so they can get socialized medicine is not somebody that cares about people or patients. I mean, there's people actually that have, they're making a poster board of, now they've knocked one CEO out, and they have the other ones to go. So sorry, you guys that care so much about healthcare. I have a hard time thinking that you care about anything.